Hi, I'm Dr. Saral Desai. I'm a graduate from Surat Municipal Institute of Medical Education and Research from India. I've been working as an assistant physician for past 2 years in the state of Missouri. Today, me and my team are going to present a case of Tianeptine abuse in adult ADHD patient. Tianeptine is atypical tricyclic antidepressant that is approved for treatment of depression and anxiety outside the United States. It is not approved by FDA in the US, but it is still easily purchased online and it's unregulated. Tianeptine was recently discovered to act as a mu-opioid receptor agonist. Mu-opioid receptors are involved in pathogenesis of addiction of opioid medication. And there are many case reports recently that suggest that when Tianeptine is used outside the therapeutic dosage for a prolonged period of time, they can produce similar kind of physical dependent symptoms that we see with usage of opioid medication. So we report a case of a 32-year-old male who presented to clinic in Ozark, Missouri with a complaint of being hooked on his AT&T supplement. He complained that stimulant medication that he was using since his childhood diagnosis of ADHD lost its efficacy after prolonged usage, and that's when he started experimenting with this ADHD supplements. He purchased Tianeptine online and initially started with 60 milligram per day and reported improved mood and motivation from its use, but lost those effects after 4 weeks of daily usage. He felt that as a supplement, it is safe to increase dosage, so he started using 180 milligrams per day. He increased the dosage all the way up to 900 milligrams per day. Eventually, he found it financially difficult and decided to stop using it. Within 5 or 6 hours of discontinuation, he experienced dysphoria, nausea, sweating, palpitation, GI upset, and tremors that resolved after ingestion of Tianeptine. For the next 2 months, he repeatedly tried to discontinue Tianeptine unsuccessfully. Finally, he decided to visit urgent care where he was given benzodiazepine medication for withdrawal symptoms, and eventually he was referred to ER for further management. So this case highlights the need to recognize and educate patients of potential abuse of Tianeptine and its ability to produce physical dependent symptoms when used outside the therapeutic range for a prolonged period of time. Our case also emphasizes the need to have strict regulation or purchase and distribution of Tianeptine in the United States. Thank you.